In chronic ischemic heart disease, there's a progressive onset of heart failure that occurs over many years due to chronic ischemic heart damage, myocardial muscle cell damage. In myocardial ischemia, there's an imbalance, as we saw before, between supply, which is perfusion, and need or demand of the heart for oxygenated blood. We also could call this coronary artery disease. That would be another appropriate name. All of your typical You'll learn them kind of as like flashed as the risk factors: family history, lipids, age, smoking, high blood pressure, exercise, and diet. So these are your classic like cardiovascular disease risk factors. This is the leading cause of death worldwide, and oftentimes the prognosis is, or the complication is congestive heart failure that could lead to a heart transplant if not treated effectively or managed. It's a long, insidious onset, oftentimes asymptomatic initially. The kind of syndrome of ischemic heart disease represents later manifestations of coronary atherosclerosis. Oftentimes, patients don't even have symptoms until post-infarction, and this is due to a functional decomposition of the hypertrophied, the enlarged, non-infarcted myocardium. So how does atherosclerosis progress? You start with an initial lesion that looks normal histology, but you have some macrophages present. That leads to intracellular fat accumulation called a fatty streak, which then leads to an intermediate lesion. This is now where we see both inside and outside cell lipid accumulation. Then we get an atheroma where we have an actual lipid core extracellularly. And then that atheroma leads to a fibrous plaque where that lipid core becomes fibrosed or calcified. Once that fibrous plaque continues to build and build and build, the lesion can become complex and it can even rupture. A rupture would be a thrombosis, and this can block blood flow. So this is kind of the progression over time, and this is what's happening inside that blood vessel and some of the signaling factors that are occurring. Etiology-wise to chronic ischemic heart disease or coronary artery disease is a reduction in blood flow because there's some sort of atherosclerotic lesion that's blocking the coronary arteries. Typically, though, you'll see a heart attack and a myocardial infarction will precede chronic ischemic heart disease, but not always. Clinically, you could see an enlarged heart that has enlargement specifically of the left ventricle muscle and even dilation of those spaces of the chambers. You can see obstructive coronary atherosclerosis on an image and oftentimes a scar in the heart from a previous myocardial infarction.